Welcome to the YMyHealth podcast, everyone. I'm your co-host for today, Melissa, and we have Kristin Oja, the founder of STAT Wellness, back with us today. STAT meaning standing for Strength to Achieve Total Wellness, and she is here to talk with us about functional medicine and biometrics. Because I think a lot of us have heard about functional medicine. I think the term, a lot of people don't fully know what all of that means and how helpful that can be to them, and also kind of the role biometrics plays. But welcome to the podcast, Kristin.
Thank you so much for having me.
You're so welcome. Thank you for joining us. So at STAT Wellness, you practice functional medicine in treating patients. There are a lot of people, like I said, who are familiar with this term, but you also hear other terms like integrative medicine or holistic medicine. And sometimes people, not meaning to, just because they don't know, are grouping all these things together, but they all do not. They're all different. And so if you could kind of start by describing for our listeners what functional medicine entails.
For sure. And functional medicine is funny. I feel like we should just call it just medicine, personalized medicine, the best medicine. To me, it's the only way it can be done. But functional medicine, it's often described as root cause medicine. But what I tell people, it takes a biology-based approach to care. So looking at our whole system as one unit instead of in healthcare, we've become very siloed. You have an endocrinologist for hormones. You have a gastroenterologist for GI. You have a pulmonologist for your lungs, right? Functional medicine is saying, okay, wait, no, you are one person. You are a whole person. All of these systems work together. We're going to take a biology-based approach and figure out where the imbalances are, what was the cause of that, and work on that to help with lasting healing. So all of us that practice functional medicine at STAT Wellness are all conventionally medicine trained. And we just decided to treat our patients in a different way.
Which is really important for people to know, and also must give each of you such a different perspective on how, and such an interesting perspective on how all of it comes together. And that leads beautifully into my next question, which is kind of how does functional medicine, like how do the two kind of maybe integrate? Like, are there overlaps between the two? And then you were starting to talk about the differences, obviously looking at the root causes. Which
Are
is
you talking about traditional medicine and functional
medicine? Yeah.
So traditional medicine and functional medicine actually go beautifully together. And we will often even lean in on traditional medicine principles. So we think about it stat a pyramid, and the base is lifestyle. So when we find imbalances or root causes, we're going to always go to our lifestyle first. The next tier is supplements and hormones. How do we optimize? How do we get ourselves more balanced? What is the root cause? And then the third tier, the peak that we like to use sparingly, is pharmaceuticals. So we do have an overlap because we value medications too. We just don't want to only put a Band-Aid on something without understanding the root cause. And then we are also very thankful for traditional medicine at STAT Wellness because we often refer out. If our patients get diagnosed with cancer, we want to get them with the best oncologist. When patients find out they have severe heart blockages, we're going to get them with a cardiologist. So we feel really fortunate to live in the United States with fantastic sick care, we call it, some of the best specialists we have in the world. But we don't want to just put that Band-Aid over, or just, if you're a surgeon, if you're a hammer, you're looking for a nail. If you're a surgeon, you want to operate, right?
Absolutely.
We got to take a deeper dive.
No, absolutely. And that's really, really helpful to hear, because I think people are really looking, again, to optimize their health, but not maybe leave behind some of those conventional principles that they're used to. So that's really helpful. And really, I think for millennials today, there's so many problems, okay, that we face. But some of the top ones that I hear about often, the people I talk with around the country, that they're looking to improve it, are issues with their energy levels. That's a big one. Fatigue, gut health, sleep. Seems to be the number of people having trouble with their sleep, and all types of trouble, has really increased in our younger age group. Cancer prevention is very big. And really how to also maintain good brain health, because interestingly enough, and sadly too, we're now seeing more people in older generations, but not that much older, and people that we know and relatives of people that we know who are ending up with dementia and with Alzheimer's. And so we're taking now, especially people in their 30s and 40s, that step of, okay, what can I do to prevent this potentially down the road too? So those are some of the things. And so how can functional medicine help with some of these really pressing issues?
Mhm. And we can break down each one because there's some common root causes, and
Okay.
may be able to go through all of them or not. But so first one, fatigue. It's why are we tired? It's typically one of a few things. One, we either have a nutritional depletion. So is it dietary intake, dietary absorption? We could have blood sugar spikes and drops. That's huge in the United States. We're up and down all day long. That's going to impact our energy. And we see a lot of hormonal imbalances. So we see a lot of adrenal issues at Stout Wellness. And adrenals are little top hats that sit on top of our kidneys, and they're how we respond to stress. And we live in a very stressed out culture, and we can't be in fight or flight chronically and still have optimal energy. So we see a lot of nutritional issues, we see a lot of hormonal issues, and we also see a lot of mitochondrial issues. And we're seeing more of these mitochondrial issues due to environmental variables and infections. So long haul COVID, mono, mold exposure, heavy metals. So fatigue, we'd kind of figure out which one of these is it. Is it a blood sugar? Is it a nutrient? Is it a hormone? Is it a mitochondria? Typically one of those.
Yeah.
Um, Working into GI is the most common thing we say. Hippocrates, or see, and Hippocrates said over 2,000 years ago, all disease begins in the gut. And then we forgot about that, right? We started
Yeah.
silo everything. But our gut makes 90% of our serotonin, our happy neurotransmitter.
Yeah.
85 plus of our immune system starts there. It's where we absorb all of our nutrients. They call it the second brain. So this gut health is so huge, and 1 in 4 people have IBS, or irritable bowel syndrome, constipation, diarrhea of unknown origin. We feel like it's probably less of an unknown origin because we do a lot of stool tests and we look at the gut microbiome, and we've been very sterile. We've been on lots of antibiotics. We have a very fiber depleted diet. And so if I were to oversimplify the gut, there's millions things it could be. It's
Yeah.
those antibiotics, sterile environment, very clean, lack of fiber, and stress is going to hit every one of these buckets. But those are some of the things we see in functional medicine with gut. And then some of the other ones, like thinking about brain health as a big one,
Yes.
we are seeing a whole lot more Alzheimer's than we've seen, and it keeps rising. And there's kind of 3 theories behind this that we're seeing.
Mm.
There's many, but 3 big ones that keep coming up. Microplastics. We're seeing more microplastics in our brain than in our liver, which is our filtering organ, which is shocking. And it's
That's a big
increased 50% in the past 8 years. So this isn't just like over the last decade, like it keeps growing up, these microplastics in our brain. So microplastics is a theory. Type 3 diabetes is a theory, going back to we all have blood sugar imbalances. And when our blood sugar spikes, it damages our brain. So if we're spiking 3 to 4 times every day, it's directly damaging the brain. So is Alzheimer's type 3 diabetes probably playing a role? And then the other big one we're looking at, and it's kind of interesting, and this one's more controversial, but cardiovascular disease is the number 1 cause of death in the United States. So we've been really trying to combat that by getting everybody's cholesterol really, really low. People
Right.
have been put on, high levels of statin. Their cholesterol has been less than 70. And us in functional medicine, we're like, well, that cholesterol plays a role in brain health and cell membrane integrity. So are we having to choose our heart or our brain in some of these situations? And we wonder that. So, I think microplastics and other toxins, blood sugar issues, we're seeing a lot of these as big drivers when it comes to the rise in Alzheimer's. And so we do need to be concerned about it in our 30s and our 20s. We run APOE a lot to see genetic risk for Alzheimer's.
Oh,
Um,
wow.
and some other variables. But those are some of the big ones that I heard you mention. And if there's any
Yeah,
other breakdown.
absolutely. Yeah, no, absolutely. And all that's very interesting. I think microplastics are a huge topic now. And a lot of times, and we've covered different things. We did a series actually about a year ago with the environment in relation to health, because we know that's such
Mm-hmm.
a point of interest for our generation. But I've seen a lot about microplastics in relation to the heart. I have not yet seen it gotten to see things in relation to the brain. So that's extremely interesting to hear, and for people to have that also kind of on their radar. And that's where functional medicine for all of these things comes in, because clearly so many of us had started out um, as millennials back in the 90s and the
Yep.
80s, as we were in mainstream medicine, not 24/7 is how we were having our healthcare. And now there are all these different issues, and obviously it's you need something more,
Yes.
way more than that. And speaking of which, when fellow millennials, uh, let's see, the ones who when those of us in the generation turned 40, which was there like a zillion articles about this, such a big deal in 2021. There was a poll that was done. It was a Harris poll, and it really stopped me because it said that 44%, so not far off from half, of the older millennials, so those who were between ages 33 and 44 at the time, had been diagnosed with at least one chronic health condition by the time they were that age. Now, we know the oldest millennials are now turning this year 44. So there are probably a lot more than that who are with chronic health conditions now. And I'm wondering if you are a millennial and there are many out there who are trying to optimize your health and seeking all different types of resources for that. Can you, even if you've had a chronic condition for several years and you're on some form of management through mainstream medicine, because that's all you've maybe known so far, can functional medicine still improve your quality of life and welcome you in, even though you've already kind of been on this path, whether or not it's even working for you, um, by any stretch?
Mhm. Absolutely. And we even have patients that start coming to us at 65,
Wow.
wondering what's happening in their body. We want a different approach. So it is absolutely never too late. And I think the thing, a lot of people, even if you come in, we have a lot of people come in with PCOS. They've been diagnosed with PCOS. They've been on birth control and metformin to manage it. And they come in, they have no idea what PCOS is. What does that actually mean in their body? What's happening on a hormonal level? What are some of the lifestyle things that can get them out of PCOS and off their medications? So you
Mhm.
have to understand, what is the chronic disease you have? Okay, it's high cholesterol. Well, how do we get high cholesterol? Maybe we had a diet low in fiber. Maybe there's genetic. Maybe it's a liver issue. Maybe it's a sluggish thyroid that's not been diagnosed. So, no matter what age you are, no matter how many diagnoses you have, no matter how many medications you've been on, absolutely functional medicine can help you. And our goal is to get people off medicine. And it doesn't always work. And sometimes you have to put people on medication. But at the very least, we want them to understand, why are they taking it? What is the root cause of it? And what are some lifestyle things that are going to help? Because let's say, for example, you have a thyroid issue and you're on levothyroxine. Maybe we can't stop levothyroxine, but why did you develop a thyroid issue? How do we start working on that to where you're not going to keep needing more and more and more and more medication?
Oh, that is what so many of us are looking for. How do we get off of medication, or prevent ourselves from getting on that? Or can we have just one
Yes.
instead of less and manage with through other means that you would learn through functional medicine? And if you could kind of walk us through, I know we've talked about a lot of different conditions, but if we could just pick one as an example of how you approach it in terms of looking at root causes, you
Hmm.
know, and then versus just coming in and looking at symptoms, which is so much, I feel like, traditional medicine. You
Hmm.
bring in the symptoms, and here's your prescription. Have a nice
Hmm.
day.
Yes,
It's
of
kind of how
course.
I feel like it is so much of the time.
Hmm. So one I think is great is hypothyroidism.
Mm.
So thyroid sits in your neck. I think this is a simple gland that's actually fairly complex. There's a lot to thyroid. And the traditional model, you go in once a year and they check your TSH, which is thyroid stimulating hormone. Thyroid stimulating hormone is only how your brain is talking to your thyroid. It's the signaler. It's not your actual T4 thyroid hormone or T3 thyroid hormone that's circulating. So let's say you go to the traditional way, they find that your TSH is 10. So now you have hypothyroidism. Now they're going to figure out what's the right weight-based dose to put you on, because you need some levothyroxine. And
Yep.
now let's recheck. Thyroid looks great. Let's check in once a year, right? Well, you're like, okay, well, that's odd. I didn't have thyroid issues last year. Where did
Yeah.
this come from? But they told you to start levothyroxine, you do, and then you go every year. Then you go to dinner and you talk to someone and they bring up functional medicine. So then you come to stat and you're like, hey, I have hypothyroidism. I'm on levothyroxine. How do we take thyroid issues? So we look at the whole health timeline. We want to know about your birth. We want to know about childhood. We want to know about everything. Then we find the thyroid is typically sluggish for one of three reasons. So we want to assess, is it autoimmune in nature? So 75% of women with hypothyroidism have Hashimoto's, which is autoimmune. And they don't check thyroid antibodies often unless you're hyperthyroid. So we are going to want to check that, because if it's inflammatory and autoimmune, it's going to be treated very different. The second one we see a lot is adrenal driven thyroid issues. So if you look at hypothalamus pituitary thyroid, HPT, and hypothalamus pituitary adrenal, HPA, hypothalamus pituitary is your big communicator to your glands. So if we have adrenal issues, we can have thyroid issues. So we want to understand that and find out through their lifestyle some of the variables there, which we can talk about. And then the third bucket is, well, has anybody checked some nutrients that your thyroid needs? Your thyroid needs iodine, it needs zinc, it needs B vitamins, it needs iron. So now we're going to see in your history, okay, well, you had mono really bad when you were 15 and you struggled with fatigue for 2 years after it. And then when you were 28, you got diagnosed with hypothyroidism. I'm going to definitely check for Epstein-Barr virus because mono is a big driver of Hashimoto's. So I'm going to look at that.
Interesting.
We also know gluten contributes to Hashimoto's. So how do you feel when you eat breads and pastas? Have you ever noticed anything? Has anyone ever tested you for gluten? Okay, well, now we know you have Hashimoto's and you also have a severe gluten sensitivity. Sometimes eliminating gluten can bring your thyroid antibodies down, and then you start to get off medicine because the root of the thyroid was these antibodies, inflammatory, right?
Yeah.
So then adrenal, we're going to look at cortisol and DHEA and pregnenolone, and we're going to talk about your lifestyle. Okay, well, this all started after you had a baby and you weren't sleeping at all. And then you decided to sign up for a marathon and your work, you got a promotion. So you have a newborn, you're not sleeping, you're training for a marathon and you got a work promotion. I'm definitely going to wonder about your adrenal glands being a driver for your thyroid. Now we need to work on stress management to improve thyroid levels. So, and then we start to piece this together. So the history really clues us in, but that's an example of hypothyroidism in conventional medicine is an easy prescription. Hypothyroidism in functional medicine is, well, why? Autoimmune, adrenal, nutritional, and work on that.
The level of difference is incredible. And
Night
what
and
you're
day.
able to do. It really is. I'm sitting here because first of all, my mom's a thyroid cancer survivor, and so I'm very familiar with all the years prior to that happening that she was on. She has Hashimoto's and, was on the levothyroxine, but also just traditionally the approach in conventional medicine, it's like, I feel like a 1 or 2 part thing and you just have to be on it. And that's just how it is. And so that's incredible that you look at all these different drivers, including the adrenal glands, which I think is something a lot of people will be learning about for the first time.
Yes.
When they're listening to this. Yeah. No, absolutely. Hang on 1 second. Let me get this paper. Because see, with the headphones and stuff, they'll be able to cut that part out a little bit, but sometimes it's sensitive. And then also when a person comes in and I know you're just explaining kind of how you go through with the thyroid, but just in general, if they're coming in for their first functional medicine appointment, what type of testing kind of would they traditionally be asked to get and what should they expect?
So we talk about traditional tests and functional tests. And I always tell people when we do traditional tests, it's not traditional markers, it's just through LabCorp. So we do a lot of testing through LabCorp with insurance for our patients. So we would do at least a traditional, we call it like a women's panel, males panel, and then we extend onto that. But all of our patients, we're going to look at B12, folate, magnesium, vitamin D. We're going to check pregnenolones, cortisol, DHEA, TSH, T4, T3 for the thyroid. If you're females, we are going to test your hormones. People are like, oh, they told me we don't test hormones. And I was like, well, hormones are complex. They're different every single day, but we're not going to use that as a reason not to test them. So we like to do those mid-luteal, first thing in the morning, fasted. My pet peeve is when patients come in and maybe they got someone to run some additional markers on them. Cortisol, they asked for it. Maybe they asked for some other markers and they ran them. But then I'm like, well, what time of day were these taken? They might have been at 12 o'clock, 1 p.m. But they're like, well, I fasted. Well, cortisol rises in the morning and gradually goes down. So we're at the very least going to do a good LabCorp panel, and we're going to be very picky about when you come in. We're going to want it to be between 1 to 2 hours of waking. You can't exercise. You can't have coffee. You can only have water. And we'll get your levels at that point. And then depending on what's going on, we do functional tests because we can't evaluate your gut microbiome well in labs. So we do comprehensive stool test. I can't see how you're metabolizing estrogen effectively in labs. So we do Dutch urine test to see your estrogen metabolites for breast cancer risk, fibroids, endometriosis, infertility. We look at hormones much deeper. We also run micronutrient tests. So in one test, we can see your antioxidants, all of your B vitamins,
Wow.
your methylation, your mitochondria, your fatty acids, heavy metals. So we run traditional on
Mm,
everybody, and then we dig deeper with functional. But we also tell patients, we want to meet them where they're at from a budget perspective.
absolutely.
And not everybody walking in the door is a zebra that needs to spend $5,000 on
Mm,
tons of testing, right?
yeah.
Maybe we just need to go to bed a little bit earlier, eat a little bit more vegetables, and take some deep breaths during the day. So we work on that lifestyle, test deeper, and then talk through. We're not going to ever push anybody into one direction.
That's such a phenomenal approach. Just as somebody who's spent so much time uh, being in the conventional medicine space and hearing from others who have and are looking for root causes, which is why you're able to find them, listening to all the different types of tests, because you would be asking so much from other other practitioners on the mainstream space who would likely not give you those tests, to be honest. And that's why listening, I'm just fascinated, and so many people will be, and those who are already with either working with you at Stat Wellness or in other parts of the country who are seeing a functional medicine provider know just what a difference, what a tremendous difference it makes. And speaking of other things you offer that are unique, I know you also offer biometric screening, which measures physical characteristics that are unique to each person. And two types you offer are body composition and the VO2 max, which I know more about as a runner. A lot of
Yes.
runners hear that term for years. Can you tell our listeners a little bit about the significance of each of those and how that kind of goes into the whole picture of things you were talking about?
Yeah. So, as I mentioned, we don't like to know weight at all with our patients because it's not
Mm,
an indicator of health.
yeah,
We know BMI is bad, but so is the weight. So, it doesn't make a difference. But
yeah.
we do know muscle is our greatest asset as we age. So, on the body composition, we want to make sure for your size, you're 100% of the muscle mass you need in all of your extremities, your
Mm,
legs, your arms, your trunk for longevity. We also want to look at symmetry. Are we balanced on the right and left side of our body? We
mm,
also want to look at body fat percent within reason, right? We
mm,
know if we have higher body fat percent as a female, we might run into higher estrogen, more inflammation. So that might clue us into looking at labs a bit differently. And it may not be a problem. We know it's also not a direct, it's a correlation, but maybe not a causation. So we want
mm.
to look at that deeper. We also like to look at resting metabolic rate. And probably my favorite marker on the in body is visceral fat. So visceral fat is
Interesting.
that deep fat that's around your
Yeah.
organs and you can't see it. So you could be a size 0 or you could be a size 10 and your visceral fat could be very different depending on the quality
Mm,
of food, our metabolic health, our lifestyle, and it's really correlated to heart disease and strokes. And then VO2 is really looking at how well do you use oxygen when you exercise? What is our cardiovascular health? Are we training in the right zones? I've mentioned burnout and adrenal glands a few times, and
yeah.
knowing your VO2 training zones can really help you perform better and also make sure we're seeing improvements in your VO2 max for cardiovascular disease, which is, again, the number one cause of death in the US.
That is so fascinating that you're able to look at all of these different things in such detail that it would be able to tell you so much more about the picture of your
Yes.
health and what to do with those tests. No, biometrics could be very, I could see how they could be very helpful to the picture. And supplements, I know you were mentioning earlier supplements, very hot topic, as you well know,
Yes.
in millennial health. People are always talking about which ones should I take and what dosage is best and what kind are safe. Um, for you within functional medicine, what role do supplements play?
Mhm. So we love supplements. They are the next tier after lifestyle. And part of this is some of the sad reality of our world,
Mm,
right? Our soil is not as nutritionally dense as it used to be, or, we're protecting our skin from skin cancer. So we're wearing sunscreen and blocking vitamin D synthesis. And so a lot of people need a couple supplements. We really try to keep it at like 2 to 5 max of the most
okay.
important things we need with what our goals are. I think there's any supplement a person brings in, I'm like, yeah, I can tell you the benefits of it, right? Every supplement that's ever been made has shown some sort of benefit somewhere at some point. But is it what you need right now with what's going on with your body? We don't want to overlook the basics: sleep, stress, digestion, fiber, hydration, relationships, laughter, and be taking 25 supplements a day.
Yeah. Yeah. No, that's a great point.
Then I feel like when I sometimes meet with my patients and they're bringing this bag full of supplements, I'm like, did we tell you to take all those? And they're like, no,
Right.
I just like get an ad and I take it and I do all of this. And I'm like, gosh, sometimes I feel like I'm supplement tweaking and not doing
Yeah.
anything different than medication tweaking, you know? So we love
Yeah.
supplements. We often need them. We want to optimize and they can be very helpful. But just because it's good for you doesn't mean you need it.
No. Great. Excellent. Excellent point. And putting all of this together, thinking about all these incredible tests and the knowledge behind them on how to kind of piece together really what is the puzzle of a person in terms of what is causing different things that they're experiencing, how you can change with all these different areas, whether it's modifying lifestyle, supplementation, doing all different types of things that you offer, which honestly you would not be able to get anywhere else. But stat wellness, which is amazing. In terms of the practicalities you were mentioning before of like health insurance, because I know people are thinking about that, especially with millennials, because some millennials, and we all know we've been hit many times by
Yes.
the job market, unfortunately. And so, and in our lives, always think about, okay, what, you know, in terms of cost, what might be covered by health insurance, what are we going to be out of pocket, how can we make it work, because it's definitely something we want to do.
Mhm.
So in terms of, you were saying some of the labs, traditional labs, will be covered by health insurance. How does it work in terms of functional medicine visits and then other things?
Mhm. So we are kind of bread and butter is our membership. So we try to lump it into a very approachable price that was very inclusive. So our medicine membership is $185 a month and you get 5 functional medicine visits a year, unlimited health coaching, unlimited dietitian, unlimited body composition scans, discounts on supplements, educational events, community outreach. We do random perks with facials places and things like that
Oh, wow.
that might come up here and there. But we really tried to make it like, what would you pay for a gym membership and how do we make it very inclusive? So you
Absolutely.
won't find prices like that anywhere in the nation for what we
No.
offer. Again, going based on patient experience and not P&L. But the second thing with the labs, because those are covered by insurance or run through insurance, but it does depend on your deductible. So like some people get surprised in November, their labs are covered 100%. And then in January, they get a $300 bill, right? So just
Yeah.
because they're run through insurance doesn't mean they're covered 100%, but we will always tell you cash pay price. And then if anybody is interested in this kind of medicine, because we say your health is your greatest wealth, I
Yes.
highly suggest getting an HSA because it
Um,
is,
yeah.
you can put $8,000 as a family. It might even be 8,500 now pre-taxed and you use it like a credit card at Stat Wellness. So you can buy supplements, you can do visits, you can get IVs, you can do injections, and pre-taxed money it makes a huge difference. So
Yeah.
little financial wellness tip, get an HSA.
Oh, that's a great financial wellness tip for sure. And for those listeners who live too far, as of now, I have no idea. No doubt. I was going to say that Stat Wellness will continue to expand in multiple locations. First, I'm sure your idea is southeast, and then moving beyond in the country. But for those who live too far but are interested, they're listening to you and they're like, okay, functional medicine is where it's at and where I should have been at years ago. I want to see where I can go, where I live in another part of the country. What are some of the qualities that people should look for, in your view, being that you're a functional medicine practitioner? What should they be looking for?
So you can go to the Institute of Functional Medicine and look at the provider database, which is where my board certification is from. So that's an easy thing you could do. And hopefully, at least then they've had some similar training. I will say not all functional medicine is the same. And so red flags to me is if you go in for the first visit and they're telling you the only way you're going to get better is if you do 3 functional medicine tests and LabCorp labs. We would never do more than 1 or 2 functional medicine tests. And that's usually only if our patients really want it. So if you're going in and your first visit is going to cost $5,000, that is a red flag to me. Like functional medicine should not be that expensive. Now, is it more expensive than going to your once a year covered by insurance? Yes.
Of course.
But that would be a red flag. And then if they keep all the supplements up front and they fill a basket full of, 20 supplements when you're leaving, also a red flag. Because functional medicine is root cause, it's lifestyle first. And we've moved everything to full script. And so we send people after their note of pretty much everything we move. So they can sit back and think like, do I want to buy this vitamin D, magnesium, omega, and probiotic? Okay, here's the 4 things I'm going to buy. You're not pressured when you exit to buy this basket of supplements and all of these functional medicine tests. So that would be my red flags when looking. And also see if anybody on their team, like at Stout Wellness, we do free 15-minute consults. Maybe you could talk with them for free first, see if their rapport, their personality, it's the right fit. But I would definitely look at IFM's provider search and use that tool as well.
Fabulous tips. Thank you. Thank you so much for those. And for those who are closer to Stat Wellness, if you can remind everyone how to find you, what's it, and to follow you as
Yes.
well. You're on Instagram and
And little caveat, we are about to launch telemedicine in Colorado, New Hampshire, Florida. We're about to have 5 more states plus South Carolina plus Georgia.
oh
We'll
wow.
be at seven states. So follow along at Stout Wellness. And if you ever want just a consultation, we can't prescribe if you're out of state. But if you ever want to chat and do a consultation, ask us questions, we're happy to help you navigate the space and get the right person if you need medications that's local. But you can find us at stoutwellness.com, at Stout Wellness on Instagram. Mine is KristinOja.com, and then Kristin Oja DNP on Instagram. And you can always call or text our office. It's HIPAA compliant text at 404-254-5905.
Perfect. Well, thank you so much, Kristin. This is so fascinating to learn, for everybody to learn about functional medicine and all the possibilities for optimizing our health.
Thank you so much. It was wonderful. I could talk about this all day.
me too. You're so welcome.